Hi friends, welcome again to Dr. Mura Health Beating Type 2 Diabetes Health Challenge, and congratulations for coming to day 5, the last day in this health challenge. We hope it has been somewhat of eye-opening, and that the very first day we're talking about type 2 diabetes. Well, we didn't mention a bit of type 1 as well. And something to note also, if someone living with type 1 diabetes, by the way, type 1 diabetes also they can develop insulin resistance. That is, of course, you have the pancreatic cells, the beta cells of islet or Langerhans that are being destroyed. So you need to use injectables. But it also what people don't realize is the more you gain more weight, the more you don't practice a good lifestyle, you gain more weight, causing even the insulin that you're injecting yourself become resistant, which means with time you continue adding the units of insulin that you're taking. So that can happen as well. Anyway, day 1 you talk about diabetes. We're trying to demonstrate how our body works, and where the problem is that intramyocellular lipid. We did mention some clinical manifestation as well, what happens when someone becomes diabetic. And those were just highlights. Of course, we didn't go into the details. Day 2, we did talk about the complications and what we often conventional medicine what it offers, and why they somehow miss the mark, and we seem to chase the symptoms. In doing so, we just prolonging the problem, and inevitably the problem comes in, the complication comes in, and often maybe too late, albeit being in so many different medication. We did talk about even the surgery that can be used for this. But then on day 3, that's where we did talk a little bit more some diets that are mainly, of course we didn't go through all of them, but mainly what is often seemed to be prescribed is ketogenic diet or Atkins diet. And we did talk about a little bit more, not much in detail, but I think I gave you ample evidence how ketogenic diet is not a way to go, especially for diabetes and for anyone for that matter. Day 4, we did then give evidence of literally the whole food plant-based diet, how people that are plant-based, they live healthier, they're leaner, and they have very low risk of developing type 2 diabetes. I hope it was eye-opening in a way, and that it gives you more evidence and which lifestyle you should start practicing. At Dr. Mura Health practice, of course, we give evidence and we help patients moving at the rate with the rate they want to go on, and we don't force people what to change, what to do. But I think from cutting a meat minimally eating maybe once a day, once a week, and coming to not having meat, eating fish, going to vegetarian, and then a veganism, whole food, plant-based diet. There's a whole range, but if you really want to cut down all the complications and all the risks, why not? I always tell my patient, just for 7 days, let's do this. Not forever, because some people think they cannot live without eating some of the harmful things that we talked about. But you know what? Once you start just a week and then 10 days, you realize actually I have never felt this great, and then you can never go back. Anyway, so today it's just wrap this up. And again, if there are questions, please do ask. And what we're going to do today is a little bit of concerns of whole food plant-based diet. And again, this is just a tip of an iceberg in our program. We have actually 6 modules going into this reversing type 2 diabetes, where you get to be equipped with the specifics and the stuff. Towards this talk, I'm going to introduce how you probably can join this program if you wish. And of course, yesterday also we did a highlight to give some testimony for those people who did participate in Dr. Mura Health program before. It was fun and it was great, but we try really to push everything in so that at least now you know what you can start doing. So talking about whole food plant-based diet, of course, one of the critiques, and I see it even on a hospital, is the issue of carbohydrates. Talking about there is this misconception. This is not science. I don't know where they get this from. That carbohydrates cause diabetes, or rather worsen diabetes. Now, of course, we did mention when we talk about keto diet and so forth. But we have three main macronutrients that our body needs. Now, these macronutrients, of course, they produce the calories, and they give us the energy that we need. Number one is carbohydrates. The second one is protein, and the third one is fat. And I just going to highlight on these two. Now, carbohydrates, of course, the carbohydrate is very important. The primary fuel for energy for our brain, for our body, is carbohydrates. Okay. However, when you start not differentiating which carbohydrates it get confused, because when you remember the simple sugar, the table sugar, or just a sweet that kids eat, or even adults eat, by the way, that sugar, that's called sugar. But then when you talk about black beans, it has also sugar. So we need to differentiate the difference between these two. There are simple sugars that can be like one molecule or two sugar. Those are that I find like in fruit, for example. All right. And then you have starches are complex carbohydrates that have two or three more sugars linked together. All right. And then you have, of course, the fibers, which often are undigestible sugars. And then you have sugars, alcohols. Now, when you talk about carbohydrates, when you eat food as whole, which from plants, the problem is, of course, we have a danger. The other time I was talking about the dangers of artificial or added sugars. We know that refined sugars are problematic, causing hypertension, diabetes, cancer, and many other things. But when it comes to the whole food plant-based carbohydrate or sugar, that food is packaged. It comes with a fiber, phytochemicals, stenols, and all these vitamins that you need. How the body is going to absorb that kind of sugar is going to be totally different from any simple refined sugar. To throw away carbohydrates based on the sugar, that is really misinformed, I believe. And like you see in the testimonies, the more you go whole food plant-based, you actually start losing weight. I know some of my patients that their doctors told them not to eat fruits, not to eat starches, so they cannot eat anything that has starch, no rice. That is so bad. And also, not only that, they tell them how amount of food they can eat, don't exceed this amount. Again, and they always focus on controlling the symptoms, that chasing the symptoms. That is really not the way to go. And then they starve themselves, but as long as the sugar is okay, that's what we need. It reminds me the joke in the hospital whereby they talk about the surgeon who like just to the operation, and they do everything, and of course, because some reasons the patient passed away, but then you can say, you know what, the operation was successful as much as the patient is dead. I know that's probably not a good joke. But what I'm trying to say is a patient may be dying, a literally diabetic patient dying, but as long as the sugar is normal, it seems like we are happy at the standard that we are using, and that is not the way to do things. Now, of course, like I mentioned, carbohydrate is very crucial because that is our primary fuel the body uses. Of course, if the body doesn't get carbohydrates, the body starts eating up the protein, like we did highlight as well, and that is it also takes longer, because primarily that's not what the body is used to. So high carbohydrates, when we talk about high carbohydrate diet, we talk about whole food plant-based type of carbohydrate, not refined, not that have been depleted, or the fiber, phytochemicals, the prebiotic and so forth, the one that have all packaged. Hey, it is good to quench hunger. It reduces hunger. It's control blood glucose. It is going to control the insulin metabolism, like we talked about before. It's going to keep cholesterol and triglyceride in control. It's going to give you good health. And again, we go into the study details into this in our program. Now, that belief really that carbohydrates cause disease, it is not science. Again, the source of these macronutrients is very important rather than the amount, right? So the carbohydrate from good source of carbohydrates it is good for your health. In fact, we're talking about the blue zone. I don't know if you have heard of the blue zone. These are people who live in the hundreds, especially in a certain part of the world. By the way, yesterday I did mention about Adventist study. One of the blue zones in the place in the blue zone is Loma Linda in California. That's where you find a lot of Seventh Adventist people. And the Seventh Adventist people, as I alluded to it yesterday, they seem to keep this health lifestyle that help them live longer into their hundreds. Now, the people who are in those blue zones, you find that their carbohydrate daily intake is more than 60% of your total of their calories. All right. Now that is very significant. Now there is a study that was actually done showing the risk of mortality based on how much carbohydrate people eat. People who eat less than 30% of total their daily calories, they have a 58% increase in mortality. All right. Those who ate 30 to 40% of total daily calories, they have a 32% increase in mortality. And then those who ate 40 to 50%, they have somewhat reduced, now went to 12% increase or mortality. The caloric intake from carbohydrates between 55 and 63 has actually shown to have no difference. But when it comes to the diet that is deprived of carbohydrates, then you have a real problem. And you know why? One of the reasons is it is depleted of all these things that we find in a plant-based world, such as fiber. We're talking about phytochemicals, we're talking about antioxidants, talking about prebiotics, talking about vitamins, minerals, essential fatty acids. These you won't find them in animals. So by pushing away carbohydrates, literally you're pushing away all the benefits and all the things that the body needs. And that's why we start having much problem. Now, what about a protein? Now, protein is, of course, just like a carbohydrate, we need it. Protein is very essential. Protein is needed for growth and development. It is used in hormones, production, enzymes, antibodies, messengers in so many different ways. Now, protein, what happens is it can also be converted into glucose for our brain and energy to be used. But that is a long process. Remember, in the keto diet, that's what ends up happening. They're not eating carbohydrates, the very primary source of fuel in the body. And then the body starts eating out their muscles, they lose muscle mass. But when the body is adjusted, giving the body what it needs, you don't have to break down the muscles. But it's good to know that you can, especially in the fasting stage, you actually might deplete all the stored glucose. You may start breaking down the muscles as well. Now, of course, we did mention from the studies yesterday how animal food causes increase in diabetic risks. We did mention that, and we talked about different reasons, from saturated fats to, of course, the heme iron. That is another issue, that complex things. Amino acid. There is amino acid that have been linked to cause to affect the insulin metabolism, causing renal metabolic disease. Now, it's very more important though. The protein that we need, it's generally recommended one that's like 0.8 gram per kilogram per day, and that is for people that are not older, and that is based on a healthier body weight or ideal body weight. That is, if according to your health ideal body weight, you should be like 75 kilogram. But now you're 100 kilogram. It doesn't mean that you're gonna take 100 times 0.8 gram. That will be way too much for you. You just wanna be based on what your ideal weight should be at that moment in terms of 0.8. Coming to the elderly people, the more you age, the metabolism or assimilating that protein becomes a little bit difficult. So you may need to have a little bit more protein. That is about 1 to 1.3 gram per kilogram per day. That's maybe adequate. But generally speaking, remember I talked about carbohydrates. Carbohydrates, the people who live even healthier and longer, their calorie intake is about 60%, 70%. And that is food that is full of fiber and the things that I mentioned. For protein, about 10 to 12%, 12 to 15% is of your total daily calories should be coming from protein. The World Health Organization recommends 10 to 15%. That is how much protein you should be actually having per day. Now, where does the protein come from? Simple. All the food that we eat, from the legumes, talking about the beans, grains, the split peas, and so forth. Talking about the protein, by the way, all food do contain amount of protein. Even the fruits, it does have 1 to 10% of protein, by the way. So to say that plant-based food are devoid of protein is really not true. And we go a little bit deeper into this. But we have a different type of protein. If you eat a very balanced health diet, you shouldn't lack really protein. The other thing that is one of the last macronutrients that is often the problem is fat. Of course, we mention fat much in this program. It's not that we don't have fat. The plant world have protein. It has carbohydrates. It also have fats. The fat that is healthy that we need. Fat, of course, is very important in structural function. It's help in building cell membranes, hormones, bile acid, immune function. Essentially, really requires our fat, and that is why God even gave us some fat cells. But the problem is they shouldn't spill over, that we started pushing fat into the bloodstream, rendering our muscle to be resistant to the insulin. So again, just to highlight these three, just to say that, hey, the whole food plant-based doesn't mean that your bones are gonna fall off. You won't have minerals and macronutrients as well. Of course, we didn't talk about some macronutrients, of which we talk about in the program. Just to know though that you're gonna get enough food, enough mineral, vitamins, phytochemicals. You're going to give more. You're going to get more than what people just that are focusing on animal food are getting. So again, these are just the highlights for these 5 days, and we try to compress everything in, but I believe just these 5 days, if you can really understand what we talked about and start practicing those things, your health will just start improving and get better. But also we want to help you making that change, because one thing that you're going to need, of course, is, and this is very important, by the way, to note, talking about reversibility of these insulin resistant type 2 diabetes or all these chronic-related chronic diseases. The evidence, the scientific evidence that we have, people who managed to reverse their condition, they did that with what called intensive lifestyle therapy. That is not to say, okay, I'm gonna eat veg today, and then next week I'm gonna do this, another week. Of course, any change that you make is gonna make some difference in the long run. But if you wanna intensively really wanted to treat and reverse this condition, you need that lifestyle intensive therapy that needs to be done. That's what I like our participant in our program. We have to take them for 3 days, right? Take them for 3 days. That's why we started reducing their medication. That's why we started literally following them up to see what happens. So you need a kind of help, someone to be able to help you going through it along. Other thing that you need to do is, of course, you need a doctor that can be able to see what you're doing and be able to adjust your medication. Because this lifestyle medicine, this plant-based eating is so powerful that if you don't decrease your medication, you might actually start going to a serious problem. That is, you start changing your diet, and you do everything right, and then you continue taking your anti-diabetic medication, you may become, or your insulin, you may become hypoglycemic. And remember, hypoglycemia can actually kill you. So that is why you shouldn't just do this in isolation without any consultation with your physician or doctor. If it is not us, please speak to your doctor. Say, hey, I started doing this. I wanted to know what can I do. So it's very important that you involve someone. Other thing, there is also something that comes along as you change. We need to change some electrolytes to see how your body is doing. We do check some bloods and stuff. Those things are very important as well. So if you really wanted to take part of this program and really go deeper and guide you in the thing that we did highlight, please give us show us a message in the group, or even you can contact us to see if you are a good fit, and then we can start this journey together. So it has been great talking to you, although virtually it has been, and we really wish you a good health. And remember, it's never too late to change. And any change that you do today is literally can start changing your health, and it can increase your longevity despite how old you are, no matter which age your health at the moment. and you don't have to always be in pain. There is something that can be done. So we thank you so much from me, Dr. Mura Health, Dr. Mura rather, and the whole team. We thank you for being with us in this journey, and we can't wait to serve you even more. Just let us know how we can help. Thank you so much.